kick off. It is 1 o'clock, so thank you to those who have joined us this morning, this afternoon for our network meeting today. Before we get started, I would just like to acknowledge that we work and live on the traditional lands of many Aboriginal clans, tribes and nations. Aboriginal people are the proud custodians of the longest surviving culture in the world. We commit to research in true partnership with Aboriginal communities and peoples, and to research that reflects the strength and resilience. And I am joining from Wiradjuri land today. If you wanted to share in the chat or online where you're joining from today, that would be great. Sorry about my tickle in the throat today. So firstly, before we move on to our fantastic guest presentation, I just wanted to remind everybody for our upcoming WHRN Research Symposium. That will be happening on Tuesday the 6th to Wednesday the 7th of October in Orange. And it's shaping up to be a really fantastic symposium again this year with some incredible guest speakers. And I think we're just finalising to head to let our people who have submitted an abstract know who was and wasn't successful. So our program is coming together really nicely. So please jump onto the website there for further information or to register. And thank you, Joe, for all of your great work in this space. So today I'm very pleased to introduce our invited guest speaker. We have Associate Professor Levi Osuagwa. Hopefully I'll pronounce that right, Levi, who today will share his insights and experiences in how to implement and sustain local journal clubs. So Levi is an internationally recognised public health and vision science researcher at Western Sydney University, where he serves as an Associate Professor of Rural Health at the Bathurst Rural Clinical School within the School of Medicine. His work focuses on disease prevention, eye health and community-driven solutions for underserved and rural populations. Levi's research spans diabetes prevention, eye and vision health, mental health and broader social determinants of health, with a strong emphasis on translating evidence into practical, community-based interventions. He's published over 160 peer-reviewed articles, with more than 86% of those appearing in high-impact international journals. He has also secured over $2.3 million in competitive research funding as Chief Investigator, with lots of really highly collaborative work involving partnerships across Australia, Africa and the Pacific, with his work frequently cited in policy and practice contexts. Levi is a Fellow of the American Academy of Optometry and currently serves as the President of the Academy's African chapter and as Director of Research and Advocacy for the African Council of Optometry. So Levi's contributions to research, leadership and capacity building have been recognised through multiple national and international awards, including the 2022 Fellowship Award of the American Academy of Optometry. In addition to his research, he's deeply committed to mentoring early career researchers and postgraduate students, strengthening research capacity and promoting inclusive global knowledge production. Levi is driven by a strong commitment to equity, collaboration and impact, and is passionate about empowering individuals, institutions and communities to take charge of their health through evidence-based awareness, locally relevant solutions and sustained global partnerships. So it's a very impressive bio, thank you. And we welcome you, Levi, today, and I will hand over for you to commence your presentation.
Yeah, thank you. Thank you, Shannon and Joe, for organizing this session with us. And thank you, everybody, for joining us. I will share my screen just so I can be able to talk through this and let you know why this is important to us. Look, I think the discussion to run the journal club was part of the WHRN initiative to get researchers in our rural space sort of working together and build capacity as well with research. So we sort of thought we could gauge the interest of people who are part of our membership, and also to see if there are other suggestions as to how we can start looking at evidence together as a team and grow our research capacity through that. I mean, that's what really led to this discussion today. And I've just tweaked the title a bit to just say beyond the journal club, which is a traditional journal club that we may have been part of in the past. What else can we do in the aspect of WHRN to sort of build capacity and start to work together as a team? So I put that together in this slide just so we can start to really think deep about what a journal club might look like in our space. and how that journal club will sort of can be sustained, going forward. And I welcome your ideas and suggestions because I've done this in the past, but I may not have done it as well as some other people who are attending today. So I'm very open to those contributions. Just before I head on, I want to also acknowledge the traditional owners of the land in which I'm speaking to you from today, the Wiradjuri people. I work from Batos Rural Clinical School. So I pay my respect to the elders past, present, and emerging, and also extend that respect to any indigenous person in our midst today and those who were lucky to work with as part of our team. I do appreciate that time uh, to work in these lands. So my talk is going to be just in the next 50 minutes. I'm kind of going run through these sort of ideas that I've put together here. We want to see how we can rethink the journal club as something that is a model that is tailored towards the rural space and we can all be part of. Why do journal clubs matter in rural health? I'll be looking through how we can move from journal club to a research ecosystem where there could be output in that space for us. What sort of framework can we design together that will work for us? I'll give you a case study of one of the journal clubs I started earlier and how that has changed to something very different from what a journal club looks like and to action and how we're able to use that space to really achieve and make impact. So I'll run you through that sort of case study today. And also what made that work for us, how we can also use that model to see if that was something that WHRN can also inculcate in what we do. We're also looking at building our own research, our own journal club through WHRN and look at how we can sustain and measure impact of that journal club if we decide to go on with that through your collaboration today. There'll be a small closing challenge which I want people to participate in. And at the end of that, there'll be a quick survey. So please don't hop off so early. We want to hear your views so we can use that to also know how to move forward. So the traditional model of journal club, if you've been part of one, which I've been in so many other ones, it's mostly reading a paper. So a paper is distributed, somebody picks it up. I say, okay, I want us to read this paper. They circulate that paper across the team. Then somebody takes the lead and present that paper during the journal club. And then we discuss that paper, people critique the paper, and then from that, the meeting ends. Usually in the ones I've been part of, those journal clubs are mostly, we have a rule that we don't criticize the papers of people who are members of the team, or rather people who are connected, are collaborators. We don't talk about those papers. So you're sort of not tearing the papers apart because there's always a criticism. Like, every research, no research is perfect. So we make it a standing rule that we look at other teams' papers, not really our team. So that's more like the traditional journal club that I've been part of. And I think that's really what most people may have been part of in the past. So my argument today is whether there's a real value of a journal club and whether that value for me begins after the discussion. Because what happens when we're gone? How do we translate that reading, that discussion into something really tangible that can then be of impact to the team? This is where my suggestion of what a journal club should look like comes in. So what happens next after that discussion is something I wanted to sort of keep an eye on today's presentation. Now, so rather than just looking at a journal club as a paper presentation and discussion, can we start thinking of it in a different way? Can we look at it as a way to solve a clinical problem? We think of a problem that we want to be part of the solution. We look at evidence around what has been done in that space. We then sort of critically appraise a paper that we choose. We say, okay, this paper speaks to this problem, but what is really going on in this paper? How can we critically analyze that paper? Just a sec, my slide has gone off. And then from there, we'll find the evidence gap, that sort of, where is that place where we can start looking at what else can we do that hasn't been done before? Could that also then lead us to forming a collaborative team? We'll create a research paper. We'll sort of, okay, let's find a team that are interested in this and can we work in this space? That then becomes where the impact begins. That leads us to a research, maybe possible publication for those who want to go through that route. And then we start to look at how do we distribute that information that we've then gathered, we've published, and then disseminate that to people so everybody can read and understand what we've done. That then leads also an impact. So this is the sort of journal club that I've created in the past and sort of still keeps working. I thought I could share that to those who are listening today and see what your thoughts are. So for me, that journal club just becomes an entry point, not where it stops after discussion. It actually begins there. What then do we do with that discussion? What then happens when we are gone? Is it just another day, come back, read another paper, and everybody goes? That could be a format that people will want to use. But for me, it should go beyond that. It should transcend beyond just reading the paper and discussing it. How can we use that to solve a real clinical problem? Really what my thoughts here would be. Now, so I looked at the rural health challenge that we have in research, and I see, for us, we are geographically distributed, widely apart from each other, so the distance is huge. We also face pressures. Today, I was talking to Shannon and Joe, and I understand the pressure of working in rural space. We take a lot of the work in because there are few of us. You find out that there's competing pressures from family, from extra teams that we belong to, from the work in our own school space. A lot of these things are things that we kind of struggle with, and that really amounts a lot of pressure. We don't actually have time a lot to do this. There's also limited research infrastructure in those in rural space compared to those in metro. We have clinical priorities that are competing with our research priorities. There's no protected time for research for many of us who are in academia and teaching, and even those in clinic as well. So there's few opportunities for research involvement and mentorship. It's difficult to also identify people you collaborate with. You may have a project, but finding that person who matches that skill set that you don't have is actually a tough one as well in the rural space. So the research questions we have are not always connected to local priorities. So sometimes the priority of our universities might differ from what we are keen and interested in researching. So how do we bring all this together to something that can be unique and tailored to our own space? For me, we can use the journal club even to fill out these needs. We may not have funding to do that, despite the low research infrastructure. There are still things that we can do, because we have people. We have people in WHRN. So what if we start connecting people, who have different skill set and talk about real issues? Use what we have to solve real problems. We can also build research capabilities across the clinician space. Even early career researchers who are also part of our team. We can use journal club to identify local problems. And then from that, we develop research questions. We create collaborations within that question and the problem that we've identified. And that then can translate to evidence that we can start to disseminate if we move further beyond the discussion. So that's the sort of model that I'm kind of looking at in this space, if everyone agrees with me at the end of this. So for me, journal club presents a very rare opportunity to all of us. It brings together people who already have different strengths. We have clinicians in our space who may be key partners in any of the problem areas that we chose to start working on. There are researchers who have the expertise in designing research studies, methodology. There are students in our midst who want to connect with researchers and bring up the new ideas to do research in the field that they are interested in. There are senior academics, who can help us with mentorship and connecting us to other networks. There's also the health service around which we can link up the local health district, the hospital services, because we also have those in our team who work in that space. We have communities who have lived experience and context that can also support us in making sure that problem the question we're asking solves real community problems and then can be used in improving the health of our community. So if we connect these trends together around a shared question, I think we'll have a great opportunity here to use a journal club to actually solve problems. Because all this exists in our field. So my thought is, why don't we use what we already have and not what we don't have to kind of solve problems? So in this slide, I've just sort of created that sort of chain reaction of how we can go from evidence to impact. And in a while, I'll demonstrate to you how that has worked in my space. And so you could say that I'm actually talking about it because I've done that. And for me, it was very productive. And I think we can include that model as well, or sort of extrapolate that model to our rural space. And that could also have similar impact. So for us, if we identify a problem that we are seeing in our clinical space, in our workplace, we can explore that problem together. What does the evidence say about this? That could be what the journal club will look like. Then when we meet, we then critique that problem. What is this evidence? Does that evidence actually speak to what we know the problem is? What are the gaps in that evidence that we have picked that we can look at? If we identify those gaps, can we then work together as a team to see how we can start to create research around that problem? Where there are the gaps, what research can we do in that space to fill that gap and maybe have a research pattern that is answerable? And how else can we translate that into something we can communicate to our community, our members, and sort of create that impact that we are looking for? So this could be the chain that we can start to think about how a journal club sort of translates into an impact that we can start creating through this community. So the question here is, so what's the test? What are we looking at? What does this evidence tell us? Is what we're asking the journal club. And for WHRN, is this evidence relevant to our patients, our communities, our health service? If it is, what should you do with the knowledge that we get from it? So this third question is where the research opportunity for me emerges. Is we have formed the journal club. If we decide to go forward, we look at evidence. What is the evidence around the problem that we identify together? Is this evidence relevant to our space, what we work in, the rural community, the rural health? If it is, then what can we do with that knowledge? That's where the opportunity for research really is embedded in this journal club space. Now, looking at this model, I had to put these thoughts together from one research journal club that I started during COVID-19. At the point when COVID came, the projection was that the African countries, are going to be, we didn't know there will be people left in those countries as of today. The projection was that many people would die. There will be lots of mortality, death from COVID-19 was going to be something else we haven't seen before. That projection was actually from WHO, and many of us were very scared. We were very scared because we had loved ones, family members in those regions, and we couldn't do much. So what I did was I thought about this as an opportunity to sort of start talking about research in this space, why things were emerging. So I rang a few friends who were into research, few members of different groups that I knew, and we started a journal club. We meet every Saturday. My time was quite early in the morning. There's in so many other countries, those were either early morning, or for them, it was also mid-afternoon. So we had people from the US, from Canada, from the UK, from Australia, from Nigeria, Ghana, Kenya, Cameroon. We formed the journal club. And we started discussing manuscripts around COVID-19 as the evidence was emerging. So that was our starting point. Our problem was the COVID-19 projection was that many of our family members in African countries will not survive. So we really wanted to see what's the evidence around this space that we can then see what we can do to help protect our community. So the journal club started as an international collaboration. Some people were involved, and they were from different institutions. They were clinicians, they were academics, there were people from community, and it was mostly focused on COVID-19. That's our main problem at the point. And at that point, there was no dedicated research funding for us. We had no formal research program. It was just a shared problem that we all can connect with, and we identified with it. So we looked at what does the emerging evidence actually tell us, and what are we still missing around this space COVID-19. That was the bedrock of the research that we've done for the last 3 years now. So in the room that we had the first meeting, there were professors, there were associate professors, there were senior lecturers, different cadre of professions, students were there, PhD students were part of us. And we started discussing. There were about 16 researchers who showed up and were keen to be part of this journal club. This then created a natural environment for us where we can exchange knowledge. Research mentorship was happening organically because of the diversity of people's academic career chains. We also had leadership in that form, which sort of provided that leadership and formation of the meeting and the groups that emerged. And today, this research group, this journal club has now transformed into a research group and is still ongoing. Now, I just want to share with you some of the outcome that we had. We had few publications in that, but I'm not sure why this is not shown. But there are a few other publications that I put in here, which you can see they're all available online. But these are where our connection and research teams came from. So these people here came from various countries and were part of this research journal club when we started. We had people from South Africa, Australia, Ghana, Nigeria, Cameroon, Tanzania, United Kingdom, Kenya, and there was somebody as well from the United States who joined us later on. But these are the team members of the first journal club that we started that sort of changed to what we have today. So just to show you the diversity of it, and they all come from different fields. There are some from optometry, some from supply chain management, some from public health. There are people working in government space in nutrition. And there's also a vice chancellor of a university in this place, in an administrator. There was a clinician who was a GP practicing. So this is a diverse group. And then we worked together since then up until date, still working as a group in so many other research papers and ideas that we have. So we started by reading. We met online during COVID. Like I said, every Saturday for me was the time. Our focus was deliberately narrowed to COVID-19 evidence because that's where we wanted our research and our discussion to be centered on. So we discussed emerging issues ranging from COVID-19, public health, prevention, vaccination, knowledge of communities, health behavior, and what the evidence around that and how that evidence has been evolving over time. So our purpose wasn't just like a journal club to summarize papers. It was to ask three questions. Is this evidence that we're getting in COVID-19 credible? Does this evidence apply to the African context? And again, what's missing? Within this space at the point, you could remember there was a time when a paper that was published on Nature was retracted because the researchers couldn't provide a data that was backing the evidence that they showed us. I think that evidence was showing that chloroquine was a possible solution to COVID-19. And there was really no solid evidence around that space at the time. And since they couldn't provide their data to substantiate that evidence, that paper was retracted. And I think that made the news at the point, and there are a few other papers in that space as well. So this was when this was happening. So we sort of followed those trends and changes across time. Now, the critical appraisal of those documents that we read changed our conversation. We started seeing gaps in the publications that we had that were coming out of COVID-19 at the point from different places. That gap that we saw led us to start to think, how then do we connect what's happening in Africa that we hear and what the research is telling us? That led us to see a gap where the public awareness was very low. People didn't understand what COVID was at the time. In Africa, it was even worse because there were so many other myths and belief systems that people had that was sort of affecting their compliance with all the policies that were being put forward by WHO, by the CDC, and all the stuff were changing as we go. So this sort of led us to think about research as a way to provide evidence to support the communities that we come from. And how that can also be used to inform future pandemics, going forward. What can we do in that space so we avoid the mistakes we made in the past? So this is where that discussion came up for my team. And we sort of used that again to start digging into research and what we can do. So having identified this gap, we wanted to know what people know about COVID-19. The knowledge, like I said, was quite low. And we heard that from anecdotal evidence, from people who were speaking to our team, from the research that was coming out. There was really so many confusion around what people know and what people didn't know. But for the African community, it was even worse because of the religious belief and the myth that was around COVID-19 as well. So we ran a survey. So, okay, can we do a survey to know what the public awareness and understanding of this condition was. So that the group mobilized our expertise. We had no funding, like I said. We started discussing how we can run a questionnaire. We designed questionnaires that ran online, and then we started collaborating between ourselves and our communities. And that journal club became a research incubator for us. It became a research that we then started doing so many work that as at the recent paper I published yesterday, we're close to about 18 or 20 publications from this particular journal club meeting that now transformed into a research incubator. So that really led us to see where the need and benefit of a journal club can really grow to something bigger. So from one question, another question created. We had done a COVID-19 research about knowledge. Then when the vaccine came up, we wanted to know what people understand about vaccine. Knowing how Africans receive or hesitant to vaccination, we thought this was going to be another problem as well. So we started looking at how can we encourage our community to key into the vaccination, at least where there's solid evidence that would help us in reducing the COVID-19 infection rate. So it was really an idea that we sold to our community through our research, and then want to know what people think about it and how we can use that to try to change behavior in our community. And that was really very useful. So the first survey went to second survey, and as we keep doing this, we're meeting every Saturday, we're writing papers, we're discussing new evidence, we're also doing research. We formed a strong collaborative team that today, that is still ongoing as a journal club, Kume Research Group, that then started doing work in that space. So the first research project actually created the next one, and that's what happens in journal club. If you find gaps in the papers that you're critiquing, you find that there's another area where you can focus on that nothing has been done in that area. So it kind of leads us into a bigger space of evidence gap that we'll start looking at what can we do in that space. I will sort of pick those that didn't require much funding or even low cost to be able to run that research group as well. So that research group is called the African Translational Research Group. That's what we called it. And it became a pipeline for research. Like I said, we read as a journal club, we read together. We came back to question those evidence. We identified the gaps in whatever literature we are using to support the idea. We started doing research to fill that gap. We adapted that research to then do a vaccination research to see whether people are willing and how hesitant they were to receive the COVID-19 vaccine. That translated into a subsequent research on the surveys ran about vaccination awareness and how can improve that across our communities. And at the time, we published about 12 articles, and which are still currently ongoing with the current evidence that we still have now. We also had 2 conversation articles published that was also disseminated within our community. What we did again was to engage the communities that we collected data from. So we ran webinars talking about our research, our findings, hearing from our community directly online, what other questions do they want to be answered? How do they see this research fit in their space? What myths and they had within their space that we couldn't kind of counter? We're able to discuss that as a group and with the community involved. So this was really impactful for people to understand what we are doing and also put their voice through as to how they believe the vaccination was going to affect their communities. So we disseminated our findings, and we now have an open book that's sponsored and run through Western Sydney University. This book was published and disseminated across all the libraries across Africa. Francis, who is one of us, works with New South Wales Library, helped us to get all the contacts to libraries around Africa, and this was sent to every one of them for free, and you could find them in so many databases and online library collections that this book became part of what students and anyone else can also have access to. And knowing that it's difficult to access journals, even from Africa, even when they are open access, people have to download one article over another. But this book sort of compiled all the evidence that we had from this group as a document, as a book, and people can just have that download at once and be able to go through that on their own. So that was something unique that we did across the space. So we were trying to really make access equitable equitable to everyone across the African school, African communities. And from that as well, we will sustain that progress, and that group continues to today. In fact, the latest evidence was published 5 days ago. From that same research during that period, you could see how that has still continued to keep that group going because people saw the need to be part of it. And there was also they gained from it, having that research, your name on the paper, to use that as an evidence for promotions as well was what so many people thought they had to key into it. So it was really good. We've published most of these articles, they're online, and that journal club created a sustained environment in which our research ideas were developed. We tested them, translated them into scholarly outputs, and distributed them to the community. So this is more like a case model of what we have done in the past that I kind of thought would be useful to the community here. And I thought if we share that with you, you may have a different idea as to what would work best in our space and how we can translate that to something that is sustainable and people will love to be part of. That's really what this conversation today is about. So these are the two conversation pieces that we published. There were a few videos as well accompanying this, so it could be played around communities and people had to download them. But it was really good that we were able to tell this in a story that, in a way that a lay person can read and understand. Because that's one difficulty with publications. We write them in language that scientists and researchers are able to understand. But communities, when they read that, community members may not find that very useful. So we made efforts to hold webinars, publish them in conversation pieces where you have to write in simple languages, and people can as well read it. And this is well read across Africa and across the world. So it was easy for people to access the evidence if they needed to. And from that, you can link up to the other manuscripts and papers that we published. So for us, research must be accessible. That's the reason why we had to do them in some of this language, in some of these publication styles. We want it to be understandable by the community who contributed to our research. We want to make sure it was relevant to the context at the point that we're discussing. And we also want to make people to be able to use that to form a discussion around the tables, around their communities, their institutions, and then they can also reach out to us if they needed to. So for us, it was not just a communication piece. It was a translational material that had impact for the communities that we wanted to target. So we had online forums, like I said, because we wanted to share the evidence as they were emerging and talk about problems that the communities were facing, answer some questions that they didn't have answers to. Because we had we had a special team in some of those webinars. We invited people from NCDC, Nigerian Center for Disease Control. We had sometime people from WHO. One of the papers was actually funded by WHO for publication because it related to combating the myth and belief systems across Africa at the point. So it was really an impactful journal club that sort of led to something that's unique and still running today. So here we shifted the idea from research publication to community engagement. We wanted to make this valuable to the community that contributed to that data set. Our thought was that webinars and conversation pieces that we wrote. So I'm looking at it now from research knowledge access. This is the book that we published, and there's a video of that book online on YouTube. And that book was distributed, like I said, across African schools. It gave them knowledge of what we did around COVID, translated that knowledge to something that people can as well key into in any feature of pandemic and what we found across the space. It was easy to access this information through the book publication that was made online and open access. I wanted to make sure that people in low to middle income countries, like African countries, are not left behind. So Western Sydney was very helpful in translating this into an open book, and that has now been sent through across all African libraries to have access to that. So for me, and looking at Journal Club from my view, it's a journal club that has an impact. And I map that impact from what I've done before and how that has translated to something that we all can relate to. This could be the journey that Western Rural Health Network is taking today. And I'm happy to be part of that first group that will start looking at how can we make our journal club impactful, so people see the benefit of being part of it. And that benefit is something they can translate to an outcome, an impact that they are part of as well. That's really what this journey for me is about. Can we build similar sustainable platforms through the community to enrich our rural research network, and as such make people find need why they have to be part of it. Because that's the point. It's not just a journal club. How do we sustain it over time that it becomes a full evidence that will show this impact chain that people can relate to? If not, the time it takes to do that, people may not really want to key into it. But when they see there's an output at the end, I think there'll be lots of interest from what we're saying. So what made it work for us? We had a clear shared purpose. We defined the evidence base that we wanted to look into. And we had to think about it critically from the different experts in the room. We question the research, we question the evidence, and make sure that we can find where the gaps are for us to key in our research. We had diverse experts' interests, so people from different walks of life, different specialties contributed to that knowledge space. We really made sure that we had this research to lead to action. Beside the research, how do we publish that? Can we disseminate that to our community? So that sort of created the momentum for us. And going forward, we still keep writing our papers and manuscripts as we speak today. Now, I wanted to note something. We had no funding. There was no funding for this group. We all met it contributed our time to it. One, we had a shared interest. We had passion for it. People were keen to be part of it because they saw the need to be involved in that. They saw their contribution to solving a real problem, and that really sort of changed the game for us. So funding is not always necessary for this sort of things to work. Yes, funding will help. It can accelerate our ideas, yes, but that's not only the reason why we need to start stuff like this. These great ideas shouldn't end just because we don't have the funding. There will be people in the room today who sort of see themselves in that space. How can we be part of this change? That's what we're looking at today, if that's something that we are keen into. Now, the journal club for me helped to generate a preliminary data that we then use to ask a research question. We can pilot that research question. We have collaborations in our group here, and that can also lead to grant concepts. If we do this properly and get a good team together, I think this is a space that we can actually use to grow our research space and grow our funding as well, going forward into what we need. And the group I'm looking at it's a big group. Western Rural Health Network is large. We've got a large membership base. If this is something that we're all keen to be part of, we have the expertise, we've got the network. There's motivation in the room. Thus, this presentation is coming out today for all of us to be part of. There are shared interests. People are already talking about this in different spaces. I bet that there are some people in this room where in their own place too, that either running a journal club or they've started talking about it. Because it's another way we can bring skill set together, start to look at real ideas and build capacity, research capacity across our team. We have access to the participants if we need to do a research or to be part of the journal club. So there's really that starting bedrock that we have here that we can leverage upon and create something unique for the space. But then what does this mean to our Western New South Wales community? Imagine a community where Journal Club identifies real problems and creates a question around that problem to solve a real problem. That will be an impact that many of us would like to be part of. It could look through, is there a rural community? Is there a chronic disease condition that we think we want to research upon? It could go through, maybe it's an aboriginal health issue. It could be mental health problem, rural workforce, health, primary care, health service delivery, access, allied health, digital health, telehealth, rural aging. These are all problems that come up in different contexts, different priorities that we can start looking into. And our journal club could be a way to look at one of these problems and create a community that can start looking into answering one of the questions that we can design around this. And then that can lead to a pilot study, maybe a grant, a research that we can conduct together, and a translation of that research finding into knowledge and behavioral change. So any of this can happen through a journal club. So not just on the lens of a discussion, a paper gotten, we discuss it, everybody goes, what happens next? Could be something organic like this, and we can use that to really change behavior and create impact. So for me, the journal club could be used to critically appraise evidence. We can use that to also build mentorship around research because of the different cadres of people in this room today. We can start to build mentorship and help the younger ones to also grow their skill set in research. It can start building collaborations through connecting different disciplines who are here, different experts in the room to sort of build a collaborative network that can move on to something bigger. It can also be used to develop our research. We can turn those questions into student projects, for instance, MD projects, clinician projects. What simple projects can come out of that? You you imagine there'll be so many of them if we start talking about real problems, and that turns into research and project ideas for our community and our students. It can also be used to develop grants. We can lead it to publications, presentations, webinars to run to disseminate those findings. It could also be a forum for knowledge translation and shared resources. This all could lead into a health service impact that sort of goes to improve rural health that we're all part of. So I'm thinking these are the sort of things that we could look at as how a journal club can solve some of the issues that we are looking at today. The 6 pillars for me that are important in sustaining the journal club for me will be having the purpose. WHRN has come up with this purpose. We see there's need to connect researchers, there's need to build research capacity. So we started talking about the journal club. So why we exist as a group, we can look at that as a purpose when we start one. What area of health are we going to look into maybe as a start? People who own this, it should be all of us. Anybody who's part of WHRN is part of this group and indicates interest to be part of it. We own that space going forward. What happens next? How do we make this consistent? How often do we want to meet? Who is going to be engaged with us? Who wants to be part of it? Who wants to participate in that journal club? It's something we'll look at the end of today through an EOI that we circulate. How then do we strengthen the network? Who is the other partner that we think is important in building this space and to sustain it? Are we going to call on the local head district? Are we looking at the PHN? Are we looking at any other research collaboration that we want to build through this space? That's something we can start looking into going forward to sustain that pipeline. And then what happens after the meetings? When we finish these discussions, when we leave, what next? Do we have a plan to what's going to happen after that? These are the sort of things I think sustain our journal club, and that I think is something that WHRN can also incorporate going forward. And just rounding up, I want to also be able to measure success. If we decide to run this, how do we ensure, or how are we sure that this is going to succeed? These are some of the metrics that I put out here for us to sort of deliberate. We want to know who is participating, how many people are interested in attending. What's the diversity in that attendance? Are they able to come back when we have another meeting? They also want to assess the research confidence in people who attended the meeting. How does that translate to their ability to conduct research or confidence in starting a research in their space? The critical appraiser skill set that we have, how is that growing over time? For some people who are starting in research early, want to make sure that they build that research skill set going forward. Have we created some mentorship going forward? Are there people who are learning and understanding how to do research more from other colleagues in that platform? And that sort of translates to that capability that we are looking at. The collaborations that we build, are there new research partnerships that we're forming through this journal club? What are the interdisciplinary projects that we are doing where there are different experts connecting to that research question to solve real problems? How has research emerged from this? Are there research questions? Have we developed protocols, grants, publications? Are we able to translate that into community forums like presentations, sharing resources within our community that come from that journal club? The impact could be measured through service improvement. Some of the research we do can then be used to improve the service in the local health district that we are part of or in the community that we belong to, and how that can also be used to influence policy. These are the sort of things that we can start measuring why this journal club continues to see how that translates to measurable outcomes. So my challenge today is for us to think about one problem. What is that one clinical or health service problem that you encounter regularly, which you don't have answers to, but you want us to design a question that can answer that question today? What's that problem in your mind? What is that What's that clinical issue where you're thinking of solving that you haven't had you haven't had success in solving that? Can we start looking at that as a team? What does evidence tell you around that problem? What is the evidence already existing in that space? There will always be something, but whether that addresses that question is the second question that we are asking. Now, what don't we know around that area? What is it about that particular problem that is still missing? And who in this room can help us answer that? Because of the diversity of interest that we have across WHRN, there will be somebody in this room who may have an idea that you don't have that could be able to help us answer that question or redesigning that question to something that has a greater impact. So my final message going through this is just journal club is not simply to read the evidence. That's been the traditional model that's been practiced, in most places. But we want to question that evidence. We want to test it. Test it by designing research questions that fill some gap in that space. We want to translate that also into something that can be used in our community to improve health. I will share that across our network, across our team, and we use that to see how we can use to solve real health problems in our community. So the best journal clubs, in my view, don't end when the meeting finishes. It's actually where it begins. That's where the partnership, the collaboration, that's where the research questions emerge. What do we do with that? It's what this section today should look like. And for me, I want to call on everyone here who is keen to, let's build this together. It's not about Levi. I was lucky to be able to have published that number of articles, but there are people in this room who are much better in so many other areas of research than I am. I could be good in quantitative research, not so much in quality, but somebody here is good in qualitative research, and that's their key area of interest. There's somebody here is a clinician, have those lived experience skills, practical skills that I may not have. That's why this is a community initiative I want us to be part of. And if you're interested in that, please, I don't want to see what your views are. I want to hear from you. And I'm going to post this web link on the chat here. So you can just fill out that survey. It's a quick survey. It will take you less than 2 minutes to do that. So we gauge interest in who in the room is interested in what we are planning to do, and how then can we make that a sustainable pathway for every one of us to be part of, for those who are keen to join us in this group. And I just want to thank you for listening, and I'm open to questions, and anyone has any question to ask, please feel free to do so. So I'm posting the link to the survey here for anyone who is keen. Please do fill it out for us. Why don't we have a look at that and contact those who are keen, and we can get this discussion going from here.
Thank you, Levi. That was fantastic. I'm not sure if you can see in the chat, Patience has written a really good post there if you wanted to. Just on mute.
Yeah. Look, I think that's really what we want. We want this to translate into impact. I wouldn't want a journal club where we just discuss and everybody goes. It's that collaboration, partnership, how do we translate that into something tangible? That will be beneficial to everybody because everybody gains from it. Besides the knowledge sharing, is the output that we have, is the collaboration that you build, is the team spirit that we have. That really helps in making this a different journal club for everyone. So I do agree. Thanks for sharing that. That's really what we want to say. Yeah, Mario said we currently have research journal clubs on the way across one of the challenges we continue to face is sustaining participation and engagement among staff interested in exploring strategies that is very true. And exactly, and this is why the case study I narrated to you was something I thought about initially, to start a journal club, I needed to know what do people gain from it. Besides their time is very precious to sit down here. Imagine a vice chancellor sitting down on Saturday morning talking about research. There has to be something in there for them. For us, what was in there is the research that comes out of it. It's how do we use that to inform our community to solve a problem. People want to be associated with something that really has impact, either in their community or to themselves too. It could be publication, research findings, or making a change in their community and they can see themselves being part of it. I think that's one way that we thought we can engage the community and make people interested in being part of it and going forward. And I do agree with you. It's really hard to keep participation ongoing. We need to find something that people key into, and that brings them back to the next discussion. Yeah.
Are there any other questions or comments for Levi?
Levi, a lot of journal clubs that I've gone to, it's just like people choose different articles. I really like the idea where you have a focus. You could put out some sort of survey at the beginning and say, oh, well, and figure out what your top, I don't know, 3 or 4 questions might be, and focuses, and then work on focusing what journals you're looking at based on what that focus the group wants. So I really do like that. And that would obviously make it more interesting for the participants and be a bit more and get them keep coming back. So
Yeah.
thank you.
And look, Darren, that is really what I think. I mean, I thought about this as a solution too, because if we have a focus, then we know the niche of people we're looking at. People identify with that because that's something they're interested in. I think you need to have passion. If you're not interested in that field, you rarely come back because it's just another reading of paper, which you can download and read on your own. But if they are into that field, they say, okay, I'm interested in solving this problem. That's really where the commitment begins. Now, the sustainability is what do they get out of it? If they are not early career researchers, they learn how to critique a paper. There's really not much for established people like you and myself. Why are you doing this? If there's no output, say maybe there's a research engagement, there's a network we are building, there's a partnership, there's a community, there's a collaboration happening where it can be beneficial in grant writing or in promotion application. You need to see something ahead. That's what really helped me in water. And I think that model will mean that people are really keen to be part of because they benefit in some way or the other. The community benefits, the persons benefit, then that really gets them coming back to their same discussion. And I do agree there should be a focus, and that's really why this is important to me.
Thank you very much.
Yeah. Yeah, and thanks, Catherine. I agree 100%. Yeah, that's where it begins. When issues are not able to be addressed, then people lose interest and they sign off. I do agree with that. Thanks for that contribution too. Look, there's a survey that we posted there. It also asks you any question that you want to explore. Please feel free to give us your ideas. And maybe we can circulate that, Shannon, to other WHRN membership to see if people may not have had time to attend. It's not allowing for select all option. Yeah, not for all. So some questions are just to have tailored answers. Some are multiple choice questions. I think, yeah, let us know what you think. It wouldn't be a perfect one. I had to improvise this quickly so I get some ideas around what we're doing and then move forward from there to the next stage. So sorry if that's not allowing you to choose all the options you want.
Thank you, Levi. We can absolutely look to distribute that survey a bit more broadly throughout the network. But thank you so much for sharing your experiences, and it's really fantastic to see what you're able to build with that the group that you mentioned there and the outputs and bringing in all of those collaborations. So lots to learn from and an exciting space for WHRN. So thank you for your time and thank you to everybody who joined today. Appreciate your support and a reminder to consider coming to the WHRN Symposium. Jump onto the website and check out the details there as the program continues to build and be a really great couple of days coming up. So thank you, everybody, and we'll see you next time.